No one has to die who uses drugs ever again. No one has to die of an overdose.
In 2021, OnPoint NYC opened the first sanctioned overdose prevention centers, or OPCs, in the U.S. Overdose prevention centers provide safety for people who use drugs. Staff can act quickly if someone overdoses. Visitors bring their own drugs and have access to drug checking, clean supplies, and overdose reversal medication, such as naloxone.
Overdose prevention centers acknowledge that drug use is occurring. The sites enable us to do the critical prevention work, the critical linkage to care work that these participants often need and don't have access to anywhere else.
Overdose prevention centers save lives and save money. OnPoint NYC reversed over 600 overdoses in their first year of operations.
When somebody overdoses in the OPC, we're very rarely calling emergency medical services. The reason being, we're reversing the overdoses before they become really serious. We have over 600 overdoses reversed. We've only called the EMTs 10 times. We estimate costs every single time you call EMTs. Not only are we saving money for the taxpayers, we're saving money for everybody, but we're also providing really loving care to the people who are coming out of overdose.
Overdose prevention centers help address the various reasons someone may be using drugs problematically. They connect people who use drugs with addiction services and social supports, including voluntary treatment. Though it's important to remember that treatment is one option, not the only one people need.
100% of our participants have been to detox and treatment, not only once, but numerous times. The 2,000 plus participants we've had, 87% of them have been connected to other programs. Holistic health, meal program, medical services, mental health services, our case management services, an array of services that we know our people need. We see a reduction in use simply because of that.
They open up to, managed care. They open up to nurses and social workers and case management. They're not doing this if you're screaming at them and treating them like criminals. They're doing this because we're treating them like decent human beings and we value them.
Overdose prevention centers help reduce public drug use. By providing space and support, they keep things safer for everyone.
You said you didn't want people using drugs in the street in your community. You didn't want open air drug use. You didn't want all these things. And we agree with you. So we took all that and brought it inside.
64% of voters support opening overdose prevention centers. The Drug Policy Alliance is leading the fight to establish OPCs on the local, state, and national level.
We're proving now that it works in America. It works in America during a very, very, very challenging time with the fentanyl and other toxins in the drug supply. When we see 5 or 6 or 10 throughout the city, we'll see a larger impact. When we see 50, 100, 200 throughout the country, we'll see the number of deaths that are averaging 109,000 reduce exponentially.
It's just not one solution to the problem of the overdose situation we have here in our country. It's a lot of things. But under the foundation of everything is love, understanding, and acceptance. And if we don't have that, nothing will succeed.